Hello, everyone. I want you to start today's lesson by reviewing the information we learned yesterday. So, I want you to review what is an athletic trainer, when was the National Athletic Trainers Association officially founded, what is the purpose of the National Athletic Trainers Association, over the years, how has athletic training changed, what is sports medicine, what are the components of the sports medicine umbrella, and what are the common employment settings for athletic trainers. So take a few minutes to review this information. You can pause this recording while you review the information and then press play once you're ready to move on. So the first thing we're going to talk about today are the roles and responsibilities of the athletic trainer. Athletic trainers are charged with injury prevention and healthcare provision for an injured patient, and this often requires a cadre of sports medicine professionals. So what this means is an athletic trainer does not work in isolation. Even at our school, where the athletic trainer is the only um, healthcare professional after school at practices, they work with other healthcare professionals who assist them with the sports medicine services they provide with the athletes. For example, they work with physicians because the athletic trainer will refer you to a physician when you require a diagnosis. Um, the athletic trainer will work with the school nurse to determine what kind of like medical illnesses you might have coming into the season. And there are other healthcare professionals the athletic trainer will work with as things arise during the season. And then, like I was saying yesterday, at the college level, the athletic trainer works with a team of sports medicine professionals, such as a team physician, strength and conditioning coach, sports dietitian, possibly a sports physical therapist for the team. Sometimes they have a sports psychologist on staff. So essentially, the point is an athletic trainer does not work in isolation, and they are not on an island. The athletic trainer deals with the patient and the athlete's injury from its inception until the athlete returns to full competition. So that's one of the differences between the athletic trainer and the other healthcare professions in sports medicine. The athletic trainer is really the only person who's there from the time the athletes get injured until they return to competition. The athletic trainers work with the patient throughout the entire process, not just for a portion of the process. So the Board of Certification is the organization that is responsible for certifying athletic trainers as ATCs, and they have 5 domains that they test the athletic trainer on to see if they're qualified to be a certified athletic trainer. These 5 domains are injury and illness prevention and wellness promotion, clinical evaluation and diagnosis, immediate and emergency care, treatment and rehabilitation, and organizational and professional health and well-being. So in this class, we cover these 5 domains, but it's more of a summary of the 5 domains compared to what you would learn in a formal athletic training program. If any of you go on to get a bachelor's degree or a master's degree in athletic training, you'll learn a lot more about these 5 domains than you will in this high school class. So I want you to review what are the 5 Board of Certification domains for an athletic trainer. Take some time to recall the 5 different domains. You can pause this recording while you refresh the information, and then you can press play when you're ready to move on. So the first domain we're going to talk about is injury prevention and wellness promotion. So within this domain, there's several components that an athletic trainer needs to be knowledgeable of. So they need to make sure that the environment is safe for the individuals that they are working with. So for example, before a game, they can do a walkthrough of the court or the field to make sure that there aren't any safety hazards. They help conduct pre-participation physicals. They help develop training and conditioning programs that ensure the athletes are properly conditioned for the season coming up. For example, last spring, I put together some circuit training videos to help the athletes stay in shape during the school shutdown. They also help select and fit protective equipment properly so they can help the football coaches with making sure the football helmets fit properly and ensuring that the athletes have all the gear that they need. They can help explain important diet and lifestyle choices to their patients, and they also make sure the patients they work with use medication appropriately, and they help discourage substance abuse within the population they work with. So I want you to think about it. What is the athletic trainer's role for injury prevention and wellness promotion? So what are the aspects they're responsible for in this domain? Take some time to think about it. You can pause the video and then press play when you're ready to move on. The next domain is clinical evaluation and diagnosis. So with athletic trainers, they need to recognize the nature and extent of the injury. They need to know both on and off field evaluation skills and techniques because, as you all know from taking Sports Medicine 1 last year, there's a certain way to do an on the field evaluation to determine if the athlete is safe to move off the field or if you should have them taken off the field with a backboard and stretcher. So we'll go over this more later when we cover the first aid chapter. We'll review all that information you covered last year, but just remember that you need to know both on and off the field evaluation skills. You need to understand the pathology of injuries and illnesses. Essentially, pathology is what's going wrong in the body when that injury or illness occurs. So essentially, the negative physiology in the injury and illness. They also need to be aware of referring to medical care. So when is it necessary to refer the patient to a physician and referring to supportive services? So when is it necessary to refer an athlete to a sports psychologist, a sports dietitian, a sports physical therapist, or other healthcare professionals that are within the sports medicine realm? So I want you to think about what I just told you. What is the athletic trainer's role for clinical evaluation and diagnosis? What do they need to be aware of for this domain? You can pause the video while you think about this and press play when you're ready to move on. Next, athletic trainers need to be knowledgeable in immediate and emergency care. So they need to be able to administer appropriate first aid and CPR if necessary. In this course, you're going to get certified in first aid and CPR as long as schools reopen, because I have to be able to test you in person. But that's one of the domains that an athletic trainer needs to be knowledgeable about because, as you all know, injuries do occur fairly often in sports, and the athletic trainer needs to know what to do when an emergency occurs. Next, athletic trainers are responsible for treatment and reconditioning of athletes and their patients after an injury. So athletic trainers need to be knowledgeable about rehabilitation program design. So what types of modalities and exercises should the patients use to get back to full strength? The athletic trainer is responsible for supervising these rehabilitation programs after they're designed. They're responsible for incorporating therapeutic modalities and exercise to help get the athlete back to full strength. And during this time, they're responsible for offering psychosocial interventions. So after an athlete gets injured, there are difficult times for them emotionally. They may go through the 5 stages of grief, which we talked about last year, where they go through denial, anger, bargaining, depression, and acceptance. So during the rehabilitation process, the athletic trainer needs to be aware of the patient's emotional state and help them through the process, and if necessary, refer them to a counselor or psychologist if the patient's emotional state is out of the athletic trainer's scope of practice. So think about it. What is the athletic trainer's role for immediate and emergency care? And what is the athletic trainer's role for treatment and reconditioning? You can pause the video while you think about this and press play when you're ready to move on. Next is the domain for organizational and professional health and well-being. So athletic trainers are responsible for certain administrative aspects of the field. They are responsible for keeping records for all of the injuries, treatments and other care that they provide for the athletes. So every time an athlete gets injured, the athlete or the athletic trainer has to keep a record of that injury. They have to write injury reports for every injury that occurs. They have to record all of the treatments that they provide the patients within the athletic training clinic or on the field, and they have to record basically when athletes came into the athletic training clinic, what kind of treatment they were provided with, what kind of evaluation was provided. So they have to keep records of everything. We'll go over this more in the next few chapters. And then they are responsible for ordering supplies and equipment. So the athletic trainer needs to make sure that the athletic training clinic doesn't run out of supplies. And each year they need to do an inventory of what they have and what they need to order for the following season. They're responsible for establishing policies and procedures. So every year I need to make sure our emergency action plan is updated. And then like last spring, I had to write a policy and procedure manual for how the athletic training clinic will be handled with COVID-19. So athletic trainers are responsible for establishing policies and procedures for the organizations they work for, and they're also responsible for supervising personnel. So for that 7th period sports medicine lab class, the athletic trainer will be responsible for supervising you when you help her at practices, games, and in the athletic training clinic. So the athletic trainer has several professional responsibilities. They are considered an educator. So the way that works is the athletic trainer is responsible for educating the patient about their injury or illness and educating them about the kind of treatment that they will be receiving. They are also considered educators because when they work with athletic training students, they teach them about the field of athletic training and how to work as an athletic trainer. The athletic trainer also is responsible for completing continuing education. So this continuing education ensures that the athletic trainer is up to date and knowledgeable with everything they need to know for their field. And every few years, they need to complete a certain amount of continuing education units to keep their certification current. If you don't complete the continuing education, then you could lose your certification. Athletic trainers could also be considered counselors. They are not licensed mental health counselors or psychologists, but they do counsel their patients because they listen to their patients' concerns and help try to provide emotional support for them. However, they are not licensed to provide mental health care. So if the patient is having mental health issues such as anxiety or depression, the athletic trainer does need to refer their patient to a licensed mental health counselor or psychologist. And then athletic trainers are also considered researchers. They need to use evidence-based medicine in their line of work. So they need to make sure that they keep up to date with the newest research regarding treatment methods and first aid procedures, so that way they're providing the best care possible to their patients. And if they decide to go on to like teach at a university and they get their doctorate, they could also be the ones conducting the research. So at the basic level, they're researchers because they need to be able to understand research that's been conducted and incorporate it into their care for the patients. But they could also become researchers themselves and conduct studies on evidence-based medicine. And then these are some of the recommended personal qualities of an athletic trainer. They need stamina and the ability to adapt because as an athletic trainer, you do work very long hours and things change all the time in the field. So games could be canceled, or an away game or a home game could be changed to an away game. And then you never know when an athlete is going to be injured. So you need the ability to adapt and you need stamina for the long hours. You need empathy because you are working with people who may be emotionally distressed or scared. So you need to try to understand how the other how your patient is feeling so that you can provide them the best quality of care possible. You need a sense of humor. There are stressful aspects of the job, so if you have a sense of humor, it makes the job a lot easier. Also, having a sense of humor makes the experience more enjoyable for the patients you're working with. You need to have good communication skills because you're working with a wide variety of people. You're working with athletes, parents, coaches, school administrators, physicians, and other healthcare professionals. So you need to be able to communicate well, both verbally and in writing, in case you have to write a report or send an email to a doctor. You need to have intellectual curiosity because you need to continue to learn all the time because there are changes in the field um, over the years and you need to keep up to date on the changes. So you always need to be learning. And then you need critical thinking ability because you need to be able to solve problems quickly. For example, if a football player goes down on the field with a neck injury, you need to decide what the best course of action for the care is pretty much immediately. So you need to have problem solving ability and a desire to learn. You also need to follow ethical practices. So there are times where you could be placed in situations where it tests your ethics and your morals, and you need to be able to follow good ethical practices by making the right decisions in those tough circumstances. So, an example of that would be in California, we have the concussion law, and the athlete has to go through several stages of recovery before they're cleared to play. Also, if you suspect they have a concussion, they're not allowed to return to the game or practice until they've been cleared by a physician. So, an example of that law testing your ethics and your morals would be an athlete showing signs of a concussion. The athlete is pressuring the athletic trainer to let him play. The coach is pressuring the athletic trainer to let the athlete play. And the athletic trainer needs to make a decision. Am I going to let him play or am I going to do the right thing and remove him from play? So there are times when your ethics are going to be tested. And then professional memberships. So you should be a member of the National Athletic Trainers Association, but there are also other professional memberships you can be part of. The benefit of this is keeping up to date with the newest research and forming networks with other people in the profession. So all of these personal qualities are helpful for an athletic trainer to have. And even if you don't have every single one of these, they can be developed. And it doesn't mean that you cannot be an athletic trainer. So I want you to review what is the athletic trainer's role for organizational and professional health and well-being. So what was their responsibility under that domain? What are the athletic trainer's professional responsibilities? And then what are the recommended personal qualities of an athletic trainer? You can pause this video while you're refreshing yourself on this information and then press play when you're ready to move on. Okay, so today we talked about the roles and responsibilities of an athletic trainer. Tomorrow we're going to learn about the role of an athletic trainer with various people that they work with. So you'll learn about the role of an athletic trainer with the athletes or patients, the role of the athletic trainer with parents of the athletes or patients, and then the role of the athletic trainer with team physicians and coaches.